We are in the third year of this COVID-19 pandemic, and I get it. A lot of us are tired of hearing about it. The rising cases, again. The new variants, again. The hospitalizations, the deaths, all of it. But indulge me for a moment, because this is important. I need you to remember how it all began. I need you to remember how we all behaved back when it all began. March 2020, the streets of major cities across the country went empty as people stayed home to help keep the virus at bay, to help flatten the curve together. People were wearing masks. People were making masks for doctors and nurses, donating their extra N95s to hospitals. And every evening we were cheering for healthcare workers, those on the front line of the war against this deadly virus. There was a spirit of solidarity around this fight. There was even growing awareness of how certain communities were especially vulnerable to the virus and how officials needed to address the gross disparities in our healthcare system. That feels like a lifetime ago, not just in terms of the time that's passed, but because of how much we've changed since then. Today, when we're still in the midst of that same pandemic, still seeing new variants, with people still dying in their hundreds daily, as we're about to reach 1 million officially dead from COVID in America, the real number is much higher than that, all that solidarity, the we're in this together mentality is gone. Now it's a you do you kind of attitude. A Wall Street Journal headline from Sunday reads, officials adopt new message on COVID-19 behaviors. It's your call. And as reporter Jared Hopkins writes, health officials are leaving it up to people to assess if they need booster shots, whether to wear a mask and how long to isolate after a positive test. I thought it was called public health for a reason. I guess not. Then you have someone like Leana Wen, the doctor and Washington Post columnist who's been a vocal champion of abandoning mitigation efforts. She wrote earlier this month, I also think it's acceptable if event organizers choose not to exercise precautions and instead put the onus on individuals to decide the acceptable risk for their own medical situation. The price to pay to avoid coronavirus infection is extremely high. Extremely high? Is that how god-awful it is to wear a mask in a crowded indoor space? That it's considered paying an extremely high price and not just, I don't know, being cautious and considerate? If you remember, it was once Republicans, lawmakers and voters alike, who were rightly criticized for speaking out against any mitigation efforts, protesting against things like masks. They were seen as reckless, as selfish, as the epitome of that rugged American individualism that has little concern for the well-being of anyone other than oneself. Well, in the wake of vaccines that have cut the risk of hospitalization and death, that's now become the prevailing approach to the pandemic across America's elite, both conservative and liberal. Earlier this month, dozens of Biden cabinet members, members of Congress, and the media tested positive after the annual Gridiron dinner in D.C. I mean, the left criticized Trump for not showing leadership in 2020, for people around Trump not doing that. And now we have senior officials in this administration. We have people who were in the line of succession coming down with COVID at this event. You have doctors like Anthony Fauci and Rochelle Walensky, the head of the CDC. They were there without the testing, without the masking, without the distancing, without any apparent efforts aside from proof of vaccination to mitigate what became a super spreader event. ABC's Jonathan Karl, who also attended, asked Dr. Fauci whether there was a lesson to be learned.
What is the lesson here? Should we not be holding events like this, or to the point we just talked about, is it time to accept that we can have an event like this, but there's going to be a risk? Some people will test positive. If everybody's vaccinated, you know, it won't necessarily be that serious.
I think it gets back to what we were discussing just a moment ago, John. It's going to be a person's decision about the individual risk they're going to take.
There it is again. Individual risk. That's not how we were told a pandemic works 2 years ago. If there was any doubt that the fight to end COVID is no longer a collective thing, that probably settles it. This shift didn't happen in a vacuum. Part of it was about appeasing corporate interests and putting the economy first. Investigative journalists Walker Bragman and Alex Koch revealed how the Koch Industries, vast, opaque, right-wing network of non-profits, have been promoting anti-lockdown, anti-public health activism, research and messaging over the last 2 years. Joe Biden appointed Jeff Zients as White House COVID-19 response coordinator, a man who had little background in public health but did have a strong background in finance. A former management consultant at Bain & Company, he later founded his own private equity firm before joining the board of Facebook for a couple of years. He was in charge. During the Omicron surge in December, it was Delta Airlines' CEO who successfully lobbied the CDC to cut down the quarantine time for people who were infected with COVID. And the heads of Delta, American, United and other carriers have been lobbying to end mask mandates on planes and in airports. The public transportation mask mandate was set to expire on May the 3rd. It was extended, but on Monday, a federal judge in Florida vacated the CDC's mandate, which means no masks even sooner than that on the planes. We'll see how that goes when it comes to moving on from COVID, aside from putting the economy first. We also have the politics of it. Joe Biden and the Democrats desperate to say the pandemic is over and that they should get credit for it as we head into the midterms. That's the strategy. But remember last summer, when Biden held an event titled Independence from COVID. Hundreds of thousands of Americans have died from COVID since that event, since that speech. And sorry, many of them vaccinated too. Hundreds, thousands more have long COVID, something no one wants to talk about. Right now, cases are starting to go up again in many parts of the country because of two new highly transmissible subvariants of Omicron, at a time when no states have mask mandates in place. Meanwhile, plenty of states are closing up their public testing and vaccination sites at a time when only a disappointing 30% of Americans have received a booster shot, which means they're particularly vulnerable to the new variants. A shamefully low rate, especially compared to other Western countries. But hey, who cares about those people anymore, right? Today it's all about the individual. It's about you. You figure things out for yourself. And even if you don't have health care or paid sick leave or access to those life-saving monoclonal antibodies or antiviral drugs, the drugs that the Gridiron attendees likely had access to, well, it's all about you. In year 3, the pandemic is a matter of status and access, is how Washington Post reporter Yasmin Abu Talib put it in a new piece. She writes people are experiencing many different pandemics depending on their job, health, socioeconomic status, housing and access to medical care. For people who are healthy and have secure housing, medical care and paid time off from work, the pandemic has largely become manageable in its 3rd year. But for millions of Americans, the pandemic remains a ubiquitous threat to their lives and livelihoods. Look, if I told you in early 2020 that there would come a time when we as a country, liberals and conservatives alike, would be ignoring the spread of COVID, ignoring rising case numbers, ignoring hundreds of daily deaths, ignoring our booster rate, and declaring the pandemic over, you would have thought I was nuts. But that is where we are today. We're not all in this together. It's every person for themselves, regardless of health or wealth. Joining me now to discuss this is Greg Gonsalves, Associate Professor of Epidemiology at Yale School of Public Health and Public Health Correspondent at The Nation magazine. Greg, thanks so much for coming on the show. You wrote in a piece last week, we are essentially leaning into public health apartheid in America now, creating 2 tiers, one for the privileged and those with resources and another for everyone else. In a way, Greg, it's been like this from the beginning, but it feels like the disregard for the less privileged who are still experiencing this pandemic has gotten worse. Why do you think that is? Where do you lay the blame for that?
Well, first of all, it's not a new phenomenon, right? Public health has always had a history of exclusion, right? If you read Jim Downs' book on smallpox after the Civil War, that pandemic has basically disappeared from American history because guess who had it? It was the newly freed slaves after the Civil War who didn't matter. If you think of the AIDS epidemic, which I grew up in, it took President Reagan 7 years to say the word HIV, say the word AIDS. Why? Because gay men and people who use drugs got it. Right now, we entered 2020 with a pandemic where everybody felt at risk and everybody was willing to join hands and fight this plague together. But I think people realize now that if you have resources, as you said, if you have access, if you have money and you have the time, you can put this behind you because you can buy your freedom. And so the country, as it has in its history, has been willing to leave people behind and make them expendable. And it's going to be people without insurance, people who are underinsured, the immunocompromised, communities that have always gotten the short end of the stick in American public health. And that's where we are today. It's both new and it's very old and deep in our history.
So given that, and I know you were an AIDS activist for the last 3 decades as well, How much, when you look at this pandemic compared to that one, is deja vu? How much is PTSD for someone like yourself who's been intimately involved in both?
Well, I thought maybe in the beginning of 2020, when you showed those pictures of us all gathering together to flatten the curve, that perhaps the United States would rise to the occasion. This wasn't a disease of disposable populations, as people thought of us back then. This was a pandemic that was hitting people from coast to coast, no matter who they were. It is deja vu again, but it's all the worst this time around. Remember, we were close to 1 million deaths from COVID-19. Over the next few weeks, we'll pass that threshold if we haven't already. And even with vaccination, we lost 200,000 people from December, January, February, and March of this past winter, even with vaccinations. And, as you suggested, there are many people, like my old friend Tony Fauci, who are suggesting this is a matter of personal risk, personal choice. And, it's create your own adventure of a pandemic now. We're no longer in all of this together. And it just saddens me that after the AIDS epidemic showed us how regarding people as disposable in America, put a country and a world at risk, we're doing it all again in 2022.
So I do want to come back to Anthony Fauci in a moment, but let's just talk about someone like a Liana Wen, Greg, a prominent media doctor respected by many. She says there's no need to restrict indoor gatherings, no need for masks because the vaccines work. They've been the game changer. Hospitalizations and death will never go back to the pre-vaccine dark days of 2020 or even 2021. What do you say to someone like her?
Well, look, this is not 2020. We have vaccines that work, that prevent disease, hospitalizations and death. But as I said, over the past few months, we've had 200,000 people die, which have been some of the worst months in terms of mortality over the course of the pandemic. And yes, this is not 2020, but it's also not 2019. We have the BA2 variant, we have still circulating virus, and God knows what variant ahead of us coming this winter or this fall or this summer. And so things like the Gridiron Dinner, where Dr. Wen suggested, it was nobody's responsibility to do anything except ensure that you had a vaccine certificate walking into that room. There were things we could have done, like pre-event testing. The White House Correspondents' Dinner is coming up. Everybody has to get tested before that. We could have done that during the Gridiron Dinner. We could have, instead of putting people at long tables face to face, we could have staggered tables throughout the room instead of having a brass band and singing out loud the old New Year's Eve anthem, Auld Lang Syne. We could have had recorded music. We set up that room to be more favorable to the virus and to the public health. And it was not about canceling events like that or forcing people to wear masks at a dinner. That kind of sort of absolutist thinking that it's lockdown or sensible, reasonable restrictions in the third year of the pandemic, it's just not helpful.
But it's interesting, that dinner is an interesting example because on the one hand, you have people saying, well, look, everyone was fine. Even Nancy Pelosi in her 80s, she turned out to be fine. It just shows how effective the vaccines are and how it's possible to have these events even if people get infected. On the other hand, we don't know what happened to the wait staff or the hotel staff. We don't know what access they had to medication, how many of them got ill or hospitalized. And also, this idea that you can just allow transmission to just continue as long as you feel fine. What happened to the variant threat? What happened to ever getting past COVID?
So I think if we took a little poll of the people at the Gridiron Dinner, they'd all been boosted. I bet some of them had second boosters, right? I bet if we could ask, many of those people who got infected, whether it was indicated or not, probably got access to Paxlovid and other sort of high-tech medical care for their disease. As you said at the beginning of the segment, 30% of Americans are boosted against the virus. So that means they are at risk of serious complications and hospitalization, potentially death. So letting cases run rampant in the United States is not a public health strategy. It's a head in the sand strategy, ignoring the pandemic and ignoring new waves until it's too late. Once hospitalizations and deaths start rising, as per the new CDC community guidelines, we've baked in a lot of sickness and death for variants that might be quote unquote mild, but are spreading like wildfire and in the aggregate are going to cause a lot of havoc.
Greg, it's obvious to me that the Democrats want to declare victory over COVID so that they can go into midterms and claim credit for defeating COVID or bringing back normal life, quote unquote. But they would also say that this is what their voters want too. A lot of Democratic voters are tired of restrictions when you look at the polling now. Some of them defected to Republican Glenn Youngkin last year in the Virginia governor's race. The Democrats say, well, we're responding to public opinion.
So look, I'm tired. You're tired. This has been 2 long years of this pandemic, right? The point is, if you read John Barry's op-ed in the New York Times towards the end of last year, what happened in the context of the 1918 influenza pandemic is that it was the last waves of the pandemic that hit the hardest because people were tired and fed up and just couldn't really take it anymore. The point is that, yes, we understand that we cannot think of doing what we did earlier on in the pandemic with some of the more sort of severe mitigation measures. But the president and his cabinet and all of the administration should be out there saying, look, this is not over. We're going to get through it together. And to really take a page from leaders past when we've been faced with a challenge and not say, you're on your own, do what you want to do, you be you. But say, we are in this together. We are Americans. We are a nation that doesn't shrink from challenges. And we're going to ride our way out of this pandemic. But we're not going to do it by closing our eyes and saying, hear no virus, see no virus, speak no virus.
Last quick question, Greg. In your piece in The Nation, which is titled Laughing Ourselves to Death at the Gridiron Dinner, you mentioned Tony Fauci, your old friend, attending the event too. I wonder, the right already hates Fauci. They already hate the CDC, and Rochelle Walensky was also there. I wonder, in a future wave, another pandemic on another illness, how seriously will even liberals now take the Faucis and Walenskys of this world, I wonder?
So I've known Tony for a long time. He is a great scientist. He's a friend. But in this case, he's wrong, right? And I think he knows who he works for. He works for the Biden administration, and the Biden administration has laid down the law. As you suggested, their polling firms are telling them that the pandemic is box office poison and mitigation measures are going to lose them the election. So we're going to tell people what they want to hear. And it's not a coincidence that Lena Wen, Tony Fauci, and others are saying the same thing, that it's your choice what to do with this pandemic now, and that we're not our brothers and sisters keepers. It's the official story. It's the official line. And Tony is speaking what the White House wants him to say, even though he always tells me, I always tell the truth, I always speak with science. In this case, he's damn wrong.
Telling people what they want to hear sounds like the worst thing you could possibly do in a pandemic. It's what we criticized Trump for doing back in 2020, but there you are. Depressing, but important. Greg Gonsalves, thank you so much for your time and your analysis. Appreciate it.